Hello everyone, welcome to another video. So in the last video we talked about pneumonia and basically infections that affect the lungs. So in today's video we'll be talking about another infection known as pertussis. So pertussis is also called whooping cough, and whooping cough or pertussis is a serious and highly contagious infection of the respiratory tract, which is caused by a particular bacterium known as Bordetella pertussis. So this infection, it is characterized by severe coughing fits that may be followed by a high-pitched whoop sound during the next breath of air. So the disease can affect people of all ages, but it is particularly dangerous in infants and very young children. So looking at this background of pertussis or whooping cough, so before the introduction of vaccines, pertussis was one of the major causes of infant mortality worldwide, and although the widespread use of pertussis vaccines has significantly reduced the incidence, there has been some resurgence of this whooping cough over the recent years. So this is particularly largely due to the waning immunity in vaccinated individuals, and is also due to the changes in the bacterium's genetic makeup causing like some resistance, and also due to low vaccination rates in some populations. So infants younger than 6 months, they are especially vulnerable because they are either, number one, unvaccinated, or they are incompletely vaccinated. So looking at the signs and symptoms of whooping cough, so pertussis typically progresses through 3 stages. The first stage is known as catarrhal stage, which usually lasts for 1 to 2 weeks and is characterized by runny nose, mild fever, occasional mild cough, sneezing, and it's usually highly infectious during this first stage. So during the catarrhal stage is usually the most infectious stage of this disease. So after the first stage, we have the second stage, which is known as the paroxysmal stage, and this stage lasts for 1 to 6 weeks or longer. And in this stage there will be signs like severe coughing, which is known as paroxysms, which that's why it's known as the paroxysmal stage. Then there will be high-pitched whoop. There will be a high-pitched whoop sound when inhaling after coughing. Then vomiting can occur after coughing too, and exhaustion will occur after several coughing fits. Then there could also be cyanosis, that is like having bluish skin or apnea, especially in infants that are undergoing this particular stage of the infection. Then looking at the third and final stage, this is known as the convalescent stage, and it lasts weeks to months. And here there will be gradual recovery, and the cough becomes less severe, but it may persist for weeks. So those are the 3 stages that typically shows the progression of these pertussis. So looking at the clinical manifestation, so the disease may present differently depending on the age and the immune status of the patient. So with infants, there will be apnea, poor feeding, seizures, or sudden death, and the classic whoop sound may be absent for infants. Then when it comes to older children and adults, there will be persistent cough without fever or the whoop sound. So looking at the etiology, pertussis is majorly caused by a bacteria known as Bordetella pertussis, which is a gram-negative Coccobacillus that produces toxins affecting the respiratory tract. So it produces Pertussis toxin, it produces tracheal cytotoxin, it produces adenylate cyclase toxin. So these toxins, they paralyze the cilia and they damage the respiratory epithelium, which impairs the mucus clearance and causes inflammation. So looking at risk factors now, number one, incomplete vaccination or no vaccination at all. Then infants under 6 months old are also at risk. And then exposure to infected individuals, like exposure to an individual that has this whooping cough, because this condition is highly contagious, especially in the beginning phase. Then also waning immunity in older children and adults, and then close living quarters or crowded environments is also a risk factor, because it's easier for infections to spread when you are living in a crowded environment. So looking at the anatomy and the physiology, so Bordetella pertussis, it primarily affects the upper respiratory tract. So it attaches to the ciliated epithelial cells lining the trachea and the bronchi. So the toxins released by the bacteria inhibit the movement of cilia. So this cilia normally helps clear mucus and debris from the respiratory tract. So this bacteria inhibits the movement of this cilia, which leads to mucus accumulation and persistent coughing. So for the pathophysiology, basically the bacteria colonizes the respiratory mucosa. Then toxin production usually leads to local tissue damage, immune evasion, and inflammation. So this damage then disrupts the mucociliary escalator, leading to mucus buildup. And then there will be persistent stimulation of cough receptors, resulting in paroxysmal coughing, the classic recurrent coughing fits. Then in severe cases, complications such as pneumonia or seizures or encephalopathy may develop. So in simple terms, the bacteria will colonize the respiratory mucosa. When it colonizes the respiratory mucosa, it will produce toxins to produce its classic toxins that will lead to local tissue damage, and local tissue damage will lead to inflammation. And then this local tissue damage usually disrupts the mucociliary escalator, and this will cause mucus to build up. So the bacteria colonizing the respiratory mucosa leads to production of toxins. This toxin causes tissue damage, and this tissue damage will lead to mucus buildup. So persistent stimulation of the cough receptors will now result in paroxysmal coughing. So this is basically the breakdown of this pertussis condition. And then when we want to look at the diagnosis, like how do we diagnose pertussis? So number one, we can do PCR, that is polymerase chain reaction, to test for nasopharyngeal, testing of nasopharyngeal swabs is usually the most sensitive method. Then also we can do cultures, but usually cultures take longer, longer to get the results, and is less sensitive, especially in later stages. So serological tests can be done too, and they are usually helpful in the later stages when the bacteria is no longer detectable. Then usually clinical diagnosis is very important, especially during the outbreaks or when the laboratory testing is not available. So other conditions that could mimic the same signs and symptoms as pertussis, we have asthma, tuberculosis, respiratory syncytial virus infection, gastroesophageal reflux disease, and bronchiolitis. So these conditions could also mimic the same symptoms as pertussis. So for the management of pertussis, looking at the pharmacological approaches, so usually antibiotics are most effective when given early in the disease, ideally during the catarrhal stage, that is the first stage, when the disease is most infectious, so they help prevent transmission, but they may not significantly reduce the severity of the symptoms once the paroxysmal stage begins. So the first line antibiotics that we could give, like number one, azithromycin. So we could give, for adults, we could give 500 milligrams azithromycin on day 1, then 250 milligrams daily for 4 days. Then for children, we could give them we could also give them azithromycin, but it will be 10 milligrams per kg on day 1, then 5 milligrams per kg daily for 4 days. Then we could also give clarithromycin. So we could give clarithromycin 500 milligrams twice daily for 7 days, and erythromycin to 500 milligrams daily for 14 days. And we could also give the combination trimethoprim sulfamethoxazole for patients that are allergic to microlides. So it's an alternative that can be given because this erythromycin, clarithromycin, all these are macrolides. So in cases where the patient is having a particular reaction to this set of drugs, we could give them the sulfonamide combination. So some supportive care that we could give to we could give oxygen to help with hypoxia, and intravenous fluids if needed, and some other nutritional supports. And usually hospitalization is only required for infants with showing signs of apnea, showing signs of bluish coloration of skin like cyanosis, showing signs of feeding difficulties or complications, such as when pneumonia starts getting involved in the, like, together with the infection. So basically the goal of the therapy for this condition is that we are trying to get symptomatic relief, so to reduce the cough severity, to prevent exhaustion from the cough, to prevent vomiting with the cough. Then we also look at etiological treatments, like eliminating the bacteria causing the infection with timely antibiotic therapy. Then also preventing of complications and transmission with early antibiotics therapy, which would reduce the spread and the chance of like getting secondary infections like pneumonia alongside with the pertussis. Then also supporting complete recovery and preventing long-term effects like prolonged cough is also part of the goals of the therapy for this infection. So in the prognosis for this pertussis is good in immunized or treated individuals, and usually infants that are younger than 6 months, they are at high risk of severe disease and severe complications. And then death can only occur from apnea or from when the secondary infections start to develop, which often occurs when there's no primary treatment. There's no primary treatment when it starts early on in the early stages. So pneumonia, apnea, encephalopathy, they are all secondary infections, and they can cause death whenever this condition starts coming. There's high chance of mortality whenever the secondary infection starts coming. So the best thing is to prevent complications. It's best to prevent complications, take the right antibiotic therapy, And usually, even when treating this whooping cough, persistent cough may still last for weeks after treatment. So it's not something that could just, it's not something that would just how do I put it, it's not something that would just go, like once you start taking your medications, you just all of a sudden you just stop coughing. Well, yeah, you have to keep taking your medications. So that's basically it for this condition known as whooping cough. Thank you.